Let's talk about mast cell activation disorder. Mast cells, when it's activated, it releases many chemicals, including histamine, and that changed the immune function. So mast cells are located in skin, intestine lining, cardiovascular system, reproductive organs, especially in connective tissues. And when this mast cell are activated in a wrong way, then you will have many symptoms. For instance, it can be rashes, swelling, itching, or pain, abdominal pain, or nausea, vomiting, diarrhea, palpitation, even low blood pressure, brain fog, insomnia, because when a histamine is released, it stimulates your brain and makes you alert. That's why when you take antihistamine, then you feel drowsy because the nerves are not as active as they should be. And all of these symptoms are related with dysfunction of the mast cells. So when mast cell is hyperactive, it releases histamine in an abnormal way. So normally when there is allergens invading the body, or there is infection or inflammation, the mast cells were activated, release a bunch of chemicals. So the histamine will increase the permeability of blood vessels, the fluids, white blood cells, and other lymph cells will come out of the blood vessel so that it can kill the bacteria or clear up the damaged tissue. Also, this histamine can cause contraction of smooth muscles, including intestinal muscle and your heart muscle. That's why it's linked with the palpitation, diarrhea, nausea, vomiting, because it causes the contraction of those smooth muscles abnormally. So the other function of the histamine is it increases the mucus production. So when there are more histamine released, you will have congestion or runny nose. And the most important thing is when the histamine is released in an abnormal way, then your immune function is out of balance because the histamine will increase the activity of the immune function. So people tend to develop autoimmune disease such as lupus or colitis, eczema, psoriasis. So this mast cell has been functioning in a right way, not for abnormal extended time or release too much histamine. All of this will tip over the balance of the immune function and causing the whole digestive system, nervous system function abnormally. So how we can manage this mast cell activity so that it can behave in a normal way. So there are two sides. One side is you go to see a doctor and they will see, oh, this problem will related with heavy metals. So you're going to go to a specialist and do the chelation of heavy metals, and you will treat your infection in an efficient way, and then you will clear up the inflammation in your gut. Either the parasite caused the inflammation or the fungus, and that brings up a very important problem, the digestive problems. And I find out people who have these problems, usually they have a very weak digestive system. Either they don't eat the right food or they don't sleep well, so they couldn't digest food in a proper way, and those big molecules of the food become a pathogen to stimulate your mast cells to release the histamine. And that's one of the reasons I find out food like extremely spicy food, sweets, or especially nuts, it can trigger this histamine release. Especially if you have the gene which make you prone to this mast cell activation disorder, then you tend to develop this disorder if you don't eat the right food. So improve your digestion is the key to improve the mast cell function. And the other thing is reduce your stress, either acupuncture or meditation or yoga. Anything can make your stress level going down, then your mast cell activation disorder will be improved. But if you do all of this and then you still have problems, then you need to check up your sleep. And there is a research showing that when you go into deep sleep, the cells which release histamine just completely shut down, especially the neurons in your brain, which use histamine as a neurotransmitter. Once you're going to sleep, those neurons just stop firing up. And once you open your eyes, started thinking, then those neurons started acting up. So you have to find a way to sleep deeply, at least 5 to 6 hours. It's better to line up with the circadian cycle. If not, anytime you have to have this at least 2-3 cycles of deep sleep. That will really regulate your mast cell activity. And I have a testimony for myself. Like when I was started when I was teenagers, I will have the hives twice a year. And I didn't have any medical background, but I noticed that whenever I feel excited, like the next day I will have a big party or dancing or something, and then I wouldn't be able to sleep at night. Then if I do that for 2-3 days, my hives comes back. And when my hives comes back, I feel tired, and eventually when I turn to 40 years old, this mast cell release histamine either and also induce the acid reflux, which I never had that before. And I didn't know that because it's not like a typical acid reflux. It's a nausea sensation and fatigue. And I used to teach in acupuncture school, and so I eat my lunch and I was thinking, oh, I'm gonna drive back to see my patients. So I drink this huge cup of coffee, which is free in the school. And this really triggers the histamine release, causing the acid reflux. And it dropped my blood pressure to the point that I have to pull over. I couldn't drive because my blood pressure just so low and my brain just shut down. And over the years, I noticed that whenever I don't sleep well or I'm stressed out or I eat too much nuts, that's all triggers this hives, fatigue, low blood pressure, insomnia. It's all connected together. So after 42 years old, I realized that I couldn't do so many things. If I do that, I will induce my hives. And when the hives comes, it can be anywhere. Like one day I will have my eye swollen, and the other day my lips will be swollen. And I couldn't work. And then there's the point that there's one time my throat is a little bit swollen. I couldn't talk. So that's why I started figuring out what kind of food can induce that, how many hours I have to get in order to regulate my histamine release. So I figured out all of those things, and the food is very important, but the number one factors to regulate my mast cells or my histamine release is the sleep. I don't sleep much. I only sleep 5 to 6 hours, but it has to be deep, non-interrupted at a regular time. If I have night shift and mess up my sleep 2-3 nights, then I need to take some antihistamine to regulate the sleep. So, so trying to eat good food and regulate your sleep and reduce the stress, because when your stress level is low and your nervous system is balanced, and nervous system is connected with your immune function. So when the immune function is hyperactive, and it will also make the mast cells hyperactive. And so let's try to regulate those mast cell functions so you can avoid allergies, you can avoid autoimmune disease, you can avoid chronic inflammation.